Am I audible?
Yes.
Just a second. So, a very good afternoon, everyone. So, we are here to talk on a very topic by Dr. Aarti Daswani. Aarti Daswani is a general dental practitioner with special interest in aesthetic dentistry and endodontics. She is accredited member of Indian Academy of Aesthetic and Cosmetic Dentistry. She has a private dental practice called Divine Smiles at Mumbai. She is a passionate academician and runs a dental academy by the same name. She has authored a book called Short Textbook of Endodontics, which is a comprehensive memory guide on endodontics for an undergraduate student, published by JP Brothers Medical Book Publishers in 2015. I hereby request Aarti ma'am to kindly proceed the lecture.
Thank you, dear Aishwarya, for a wonderful introduction. And thank you, all you people, to join today. Let me start sharing my screen. So before I start, can you just confirm whether my voice is audible and my screen is visible?
Yes, it is, ma'am.
Okay. So thank you so much, everyone, for joining in today. So today here I am talking about Smile Rejuvenation, simple and non-invasive ways. To let all of you know that this lecture is brought to you by GSK Pharma. And I really thank Aishwarya for approaching me and for giving me this opportunity to take up the session on this particular topic, which is really my favorite one. So what does rejuvenation mean and how can we practice it? So by dictionary, rejuvenation is an action or a process of giving new energy or vigor to something. It is basically the restoration of a youthful appearance to something. So the title of my lecture is Smile Rejuvenation, which definitely has these two perspectives. A young looking patient, in a young looking patient, how can we rejuvenate a smile? By giving new energy, bright and beautiful look to her or his smile. And to an old patient, smile rejuvenation would be the restoration of a youthful appearance of the smile so that an older person looks younger. So it is basically a human inherent desire to look younger than their age. And as we know, the lower third of the face is our field wherein, like, we can help our patients to look young. So coming to the perspective of aging, we know that aging is a natural process. It is inevitable. It is not possible to stop aging, but yes, we can definitely slow it down. So with aging, what happens? The entire body undergoes wear and tear, and there's a lot of accumulation of damage all around. But what are the ways by which we can stop? We can actually a little bit slow down the aging. So we know that if we are into a stressful and an unhealthy lifestyle, like having unhealthy diet, having a sedentary lifestyle, and consuming, having bad habits such as tobacco, alcohol, smoking, and all those things, all these aspects are going to quicken our aging. We're going to age faster. And if at all we have a holistic and a balanced, healthy lifestyle, then it can slow down the aging process. The processes like meditation, mind and body balance, active lifestyle, keeping the body physically active, all these things are known to slow down the aging process. Not only that, the aging is slowed down and we can also have a healthy life. So healthy and as well as a long life is possible by following a holistic, balanced, healthy lifestyle. So coming back to our area of interest, when our patients have these kind of unhealthy eating habits, like consuming a lot of snacks or sweet things every now and then, whenever they consume a lot of aerated drinks like coffee, tea, to a very great extent, or when they just don't do exercise and they have a lot of stress in their life, or they have habits like smoking, tobacco, or they just don't maintain their oral hygiene, we have seen that the dental age suffers. The patient looks older as compared to what the actual age is. So the dental age is actually preceding their actual age. But our purpose is to make them look younger, not older. So this is these kind of patients are the ones we come across every now and then. Now coming back to the topic of smile, in the smile there are two components. So this is the lower third of the face, which is our area of interest. Smile, the first component is a dentogingival component, that is the teeth and the gingiva. And the second component is a perioral component, that is the other areas around the teeth and the gingiva, including the lips, the cheeks, and the chin. So here we are today trying to see like how we can improve our smile by working on these components. Okay. So coming back to some basics, which is the which will form the base for the rest of my lecture. So we need to understand that a tooth or our gingiva can remain healthy when we have these three essential minerals: calcium, phosphate, and fluoride. Also, some amount of vitamins like vitamin C, D, E, and other minerals such as potassium, magnesium, and iron. When adequate amount of all these minerals are present on the teeth, in the mouth, then it strengthens the teeth, it protects the teeth, and it has an antibacterial effect, and it is definitely anti-cavity. It stops the caries, or it prevents the caries to happen. So just remember this slide, that whenever we want to give a healthy smile to the patient, we must keep in mind that these minerals are in optimum quantity in the patient's mouth or on the patient's teeth. The second basic thing I would like to speak about, this was about the dentogingival component. Now we come to the perioral component. So coming back to basics of anatomy, we have studied the muscles of mastication and the muscles of facial expression. So on the face, we have four muscles of mastication with the different functions: elevation, retraction, all those functions are there. But what is important for the purpose of this lecture is the muscles of facial expression. So we know that a young patient would have very firm face, whereas an old patient would have sagging and wrinkles on the face. So it is not just age which causes sagging or wrinkles. Also, there is, if the facial muscles are not exercised, it causes a sagging and wrinkling of the face. So here, this area is called as a knot. It is a modulus, the corner of the mouth, which is composed of these five muscles: the orbicularis oris, which forms the lip area, the surrounding of the lip, then the buccinator muscle, then down we have the triangularis oris, and up of this modulus is caninus and zygomaticus muscle. So these five muscles, they help us in expressions. So if you imagine with our lower third of the face, we make so many expressions. You might have seen on the mobile, there are so many emojis of different expressions, wherein just this lower third of the face is the most expressive area of the face, where we show frown, where we show smile, where we show laughter, everything. So we need to understand that the dentist role is not only just the teeth and the gingiva, but also we can extend our role to the muscles of facial expression, to the muscles of lower third of the face, and even to the muscles of the whole face. So just keep these two basics in mind, that to keep the teeth healthy and the gingiva healthy, we must have these minerals, we must have these vitamins. Secondly, to keep the face healthy, to keep the muscles of the lower third of the face healthy, the perioral anatomy to be healthy, we must understand the muscles of facial expression and how to exercise them to give the best smile to our patients. So what makes the smile look older? This is a picture from a textbook called Fundamental of Aesthetics, wherein we can see that an old patient smile, it shows sagging of the face. So because of the gravity and because of not used to the full capacity, the muscles are sagging down. Then these nasolabial folds have become very deep. So these are called deep nasolabial lines. Then with age, the lips, they fall down with gravity, and also there is thinning of the lips. Further, the teeth, because of the wear and tear, because of attrition, the teeth become shorter in height. Also with aging, the enamel gets worn off and we have dull or yellow looking teeth. Also, what is weak smile? So weak smile is basically when the corners of the mouth, they droop down instead of coming up. So a lifted smile is a younger one. But if the smile is drooping down, it gives a very old look to the patient. Lastly, the tension of the facial muscles during the smile. So just have a look at this lady. when she's smiling, she has to apply a lot of effort in smiling. Whereas when you see a small child smiling, it is just so effortless. So a child, a younger patient, when they smile, it's very effortless. But when the older patients have to smile, they have to put a lot of efforts, and we can see the tension on the entire face. Okay, so the smile can be rejuvenated by many minimally and moderately invasive procedures. Like we can have full mouth rehabilitation, we can have aligner or the braces treatment to improve the smile of the patient. Then we can also have the facial rejuvenation procedures, which are nowadays quite common, like for the facial aesthetics, like Botox, fillers, lasers, thread lifting, PRP, etc. But these are the topics which are not going to be covered today. These are not my topics of concern. So my topic of concern is very simple and non-invasive ways of smile rejuvenation. Because I have seen in my practice, even like when we learn all these procedures, we want to give it to our patients. But majority of the patients in my practice say that, they want something which is non-invasive, something that is very, very minimally invasive, something very little. By doing little, they achieve more of good smile. So I'll be covering these 5 topics. First is the oral hygiene maintenance. Second, I would cover up a new concept called the Smile Spa appointment. Thirdly, remineralization. Fourth would be bioactive restorations that heal the tooth. And lastly, we will cover the smile fitness workout. Okay, so before I proceed further, I just want to ask whether everything is clear, my voice, internet connection, the screen, and everything is visible and audible. If anyone can just message me.
Yes, ma'am, it is.
Okay,
Please.
thank you. Okay, so it's going nicely. Thank you so much. So let's
Yes.
further. So first is the oral hygiene maintenance. So this is very, very basic. Each and everyone right from the graduation days are doing the scaling and polishing. But what I need to point out in this particular thing is something that I learned from a very senior and a very well-known periodontist, that why do our patients suffer sensitivity while we do the scaling? So his tip was always use lot of water. Sometimes we feel that water would keep on spilling down of the patient's mouth, and we keep the water a little less to make the patient comfortable, but we end up having a lot of sensitivity on the teeth because it gets heated up. So the first tip to have less sensitivity while teeth scaling and after scaling is to use a copious amount of irrigation with water. Also, whenever we are doing the scaling, use the lateral surface of the scaler tip. Don't never use the tip of the scaler tip to do the scaling. So when we use a tip of the scaler to do the scaling, it actually causes scratches and it causes some bruising. So even the side surface of the scaler tip, it is a surface which is meant for scaling. So always use the side surface of the scaling for doing your scaling, and you would definitely see that your patients would have less post-operative sensitivity and even intraoperative sensitivity. So this was what we can do for oral hygiene maintenance at the clinic. Then we ask the patients to use some toothpaste at home for their oral hygiene maintenance. Now, some patients who come with just stains, the only thing that they can have is a sensitivity. So we can use some paste called as Sensodyne Repair and Protect. We can use Sensodyne Rapid Relief or any brand which contains the required amount of minerals that we just discussed that the tooth requires: fluoride, calcium, phosphate, all those things. And if the patient comes with a lot of gingival issues, gingival inflammation, a lot of calculus and plaque, so along with the Sensodyne or just as an individual, we can prescribe them the parodontics toothpaste. Okay, so we'll see how do they work. Now the Sensodyne Rapid Relief, it provides rapid protection for the sensitive teeth, but the criteria is that it relieves the sensitivity pain in just 60 seconds. So that means the criteria is that the paste should be in contact with the tooth surface for about 60 seconds. This is very important instruction that we need to give to the patient, because what happens is if we just ask them to use this paste, they're just going to apply it and just wash it off, and they'll say that the paste doesn't work. So the Sensodyne Rapid Relief, it contains stannous fluoride and potassium nitrate. So we understand that the potassium nitrate is a mineral which is a very important anesthetic agent. So it enters the tooth, it desensitizes the nerve, and then it comes out fast. So it enters the tubules, desensitizes, and quickly comes out. But the fluoride, the main aim, fluoride main function is it goes very slowly into the tooth tubules, and then it stays there and it causes a barrier over the exposed dentine. So what we do in our practice is, after we are done with the scaling, we make the patient sit. We isolate the teeth with some very light cotton rolls, and then we take an applicator tip. We remove the rapid relief toothpaste and apply on all the teeth starting from the lower anterior teeth. And we actually let it remain for 60 seconds, and then we wash it off. This helps the patient understand that how 60 seconds the paste has to be applied. And once the paste comes in contact with the saliva, it starts acting and it actually gives relief. Also, we have seen in such cases, the post-operative sensitivity actually reduces or it curtails to 0. Then now we have a better paste, which is called Sensodyne Repair and Protect, which provides deeper repair and long-term rapid protection against hypersensitivity. Why? Because they have done a lot of research and they have come up with a material called Novamin, which is the main ingredient of the Sensodyne Repair and Protect. What is it? It is basically advanced calcium and phosphate bioglass technology. So remember that basic slide where I told you that for a tooth or for the gingiva to be healthy, we need calcium, we need phosphate, and we need fluoride. So understand that any brand of the toothpaste, if they are incorporating these things in their paste, it is going to work in our patients. So don't get confused which brand to buy. This Sensodyne, since I've been using it for a very long time, I highly recommend it. And I am telling you because all these things are included, which are required to be present in a desensitizing paste. So we have Novamin and sodium fluoride. So Novamin, the purpose of Novamin is that as soon as it comes in contact with the saliva, it releases calcium and phosphate ions and forms a hydroxyapatite-like layer within the dentinal tubules. That immediately reduces the dentinal hypersensitivity. Also, there is sodium fluoride, which again blocks the dentinal tubules and reduces the hypersensitivity. Then I told you, whichever patient comes with a lot of gingival problems like plaque, grade 2, grade 3 calculus. So for such patients, we need to prescribe them a paste called as parodontics. So we need to understand how does it work. It has 67% sodium bicarbonate. So we understand the bicarbonate, it is alkaline in nature. It has an antibacterial effect. So it is going to reduce the bacterial flora all around the gingiva, and hence it is going to give healthy gingiva. Also, it contains fluoride, and we understood that fluoride is an important mineral which is required not only for the health of the teeth, but also for the health of the gingiva. Okay, so this completes my first non-invasive way, just giving a proper oral hygiene to the patient by doing a regular scaling and polishing procedures, but keeping in mind all the instructions that I just told you. Okay? Now comes to the second very non-invasive way, and of late, like which I've started just loving this procedure, which is called as the Smile Spa appointment. So basically, whenever patients are looking to go for a salon, to go for a spa, they look forward to going. But when they have to come to a dentist, they forcefully come to us. Very few patients, they willingly come to us just for some bond-based dentistry. But most of them, they are scared and they don't want to come to the dentist. So we want to make our clinics and our practice in such a way that the patients look forward to coming to our clinic and having a brighter and a healthy smile. Okay, so we need to focus on giving something which is a very pleasant experience, and at the same time, it gives them health. Okay, so it is called as a Smile Spa appointment. Just a very classy name, but what it basically means is just the teeth whitening appointment. But how teeth whitening appointment can be combined with some relaxing music that the patient likes, with some aroma, a soothing aroma that the patient likes. And we know that a brighter and a whiter smile looks more youthful. But always remember the prerequisites for a teeth whitening procedure is that in the first appointment, you should have completed the scaling and oral prophylaxis. You should have properly tackled the sensitivity by prescribing the patient Sensodyne Rapid Protect or Sensodyne Rapid Relief or Protect and Repair paste to the patient, or by using something called ACP gel from Pulpden. So ACP gel basically contains this calcium phosphate, amorphous calcium phosphate, and it also has fluoride and it has potassium nitrate. So basically just try to understand the concept that which minerals are required for the teeth health, which minerals are required for tackling with the sensitivity, And then you can select any particular brand of your choice. And since we are having good experience with GSK Pharma for so many years, we can use their products as well. Okay, so the prerequisite is that we need to have the prophylaxis completely done. We should see that there should not be any abrasions to the any of the teeth. Check always the cervical portions of the teeth, and always see that none of the teeth are caries. Okay, so only then this appointment would be a pleasant experience. Otherwise, the moment you apply some bleaching gel, it's going to cause a lot of problems to the patient. Okay, so combined with these things, the prerequisites, and if you do the teeth whitening procedure with some amount of music and some amount of aromatherapy, it's actually going to give a marvelous experience to the patient, and patients look forward to come to our practice for such an experience. Now, for many years, I myself had a lot of mind block regarding the teeth whitening, because I used to consider that it's a very cosmetic procedure, and by it, like, I'm not providing health to the patient. I'm just doing some harm to the patient. Then I used to be scared of people saying that teeth whitening causes a lot of sensitivity. Then teeth whitening doesn't last for very long. We do the whitening, we get results, but then it vanishes, and patients come back to the normal shade. And then I used to feel like I used to get so scared that once or twice when I attempted whitening, I used to apply the whitening gel in a very thin layer, and then I used to see that there was no result. And then in my mind I had, oh, whitening doesn't work in my hands. But it was when I myself underwent the whitening procedure, and I found my teeth to be better, brighter, without any sensitivity, and having that proper bright look. I started having faith in the whitening. So it is always said, it's a very nice quote by Roosevelt, that it is not fair to ask of others what you are not willing to do it for yourself. So if at all you want to incorporate the teeth whitening procedure at your clinic, first get your own teeth whitened. Okay, so then I started looking for different brands and products with which I can do the whitening. And I was looking for a particular whitening agent which would give natural shade to the teeth. So some patients, they desire extremely white, with some patients call it as a toilet white or a tile white color of teeth. Then some patients, they require very just natural bright shade, which will which will make their smile brighter and not excessively white. So I realized that if we are using high concentrations of hydrogen peroxide, or if we are doing light assisted, laser assisted whitening, in office whitening, we were getting very good, extremely white teeth. But also they were combined with sensitivity problems, or sometimes they used to on the chair we used to achieve brilliant results, and then they used to fade back. But I realized that when we were using lesser concentrations of hydrogen peroxide, we were not getting a lot of good results. So I was looking for a product which would contain some minerals which will actually make the tooth healthier, and at the same time it would have some desensitizing agents, so that after the whitening the patient doesn't suffer from any sensitivity. So fortunately, I came across a company called Pulp Dent, and I started using their products, which is called Philips Day White and Philips Night White. And I was really surprised, because that is the only bleaching agent which had the properties which I was looking for. It it has incorporated desensitizing agents such as potassium nitrate, fluoride, and ACP in it. Secondly, it uses very low concentration of hydrogen peroxide, it's just 14%. And the same product, when we're using at home, we use 22% carbamide peroxide. So I experimented. I started using it on my assistants first. And once I got good results, it gave me confidence to start using it on my patients. And then once you are confident of doing the teeth whitening, you find that, you attract patients who are looking for that kind of treatment. So this was my case with Zoom Day White 14%, which gave me very good results. So on the chair, we could achieve almost B2 shade, 5 shade jump. And we took a post-op photograph even after a week, and the shade was stabilized. Then we had another case in this patient who used to be very shy of smiling, because she always felt that her upper two front teeth are larger in size. But once the whitening was done, her confidence level increased and she had zero sensitivity. Also, this patient is actually, I mean, she was actually having a very, really a model kind of a look, wherein, like, we could achieve almost A1, B1 shade for her, but it got stabilized to B2 after a week. So, what is important in teeth whitening? We are not going to discuss the steps of whitening, but what you need to understand is there should not be any pink visible. So, whenever you are applying a gingival barrier, use it very nicely so that you cover entire pink portion of the gingiva. All the soft tissue should be covered with the cotton rolls with a lot of isolation with the retractor in such a way that there's no pink portion visible. This is the golden rule of teeth whitening. Secondly, another golden rule is whenever you apply a blob of bleaching agent, you need to apply a thick gel. Don't apply a thin gel, because when you apply a thin layer, it is not going to work. So apply a very thick blob of gel on the center of the tooth, and then with the micro applicator tip, you can just brush it off towards the cervical and then to the incisor. So with this, I could also achieve very good shade. Okay, so this was about the teeth whitening. So teeth whitening, I've really started loving this procedure, and also I have done a lot of patients, and patients are looking forward to come to the clinic to have this kind of experience. Now we go for the third aspect of the today's webinar. It is remineralization. So remineralization is basically we can give some fluoride to the tooth. Now what happens is our saliva itself contains some amounts of fluoride, but our teeth are very deep in nature. They are like, they have deep fissures. They have inaccessible areas wherein the fluoride of the saliva is not able to reach those areas. So why not give something to the patient which will add some fluoride on the tooth? Remember that basic slide where I showed you, if we have good amount of calcium, if we have good amount of phosphorus, if we have good amount of fluoride, we are going to protect the patient's teeth. So a very good way of applying fluoride is either you give them fluoride mouthwashes, you can recommend them fluoride toothpaste, or else in office, because see, we can't trust the patient whether they'll use what we are asking them to use. So we need to do it on a chair side. In front of us, we need to do something for them. So we can use the fluoride in the form of varnish or in the form of gel. Okay. So the benefits of fluoride, as we had discussed earlier also, it reduces the enamel demineralization. It promotes remineralization. It reduces the bacterial growth. It increases the acid resistance. And also it prevents the dental caries. So basically, when it's going to reduce the bacterial growth, even the gingival condition is going to get improved. Also, it is going to act as a cavity fighter. So patients would have less and less amount of decay in their teeth. And it is going to remineralize whatever parts of the tooth have got demineralized, they will get remineralized. So in this way, we are helping our patients. So earlier, my concept was we are using fluoride varnish only for children at particular age when they're growing, when the permanent teeth are erupting. So I was using the preventive treatment like fluoride and pit and fissure sealants. But of late, I realized that if the components are very helpful, why not apply it on the adult teeth also? So I've started using the fluoride varnish on the adult teeth as well. Now in the adult teeth, once you apply the fluoride, similar to the children's teeth, the effect is going to last only for 6 months. So we need to reapply. But we are not going to apply the fluoride varnish in each and every patient. We're going to select the cases who have high caries index, cases who like they come always come with a lot of plaque on their teeth surfaces. So who have acidic saliva. So all those patients, we just need to understand the concept how fluoride is going to help a patient, and that will help us in the thinking process of which cases are required or indicated for doing the fluoride. So again, I'm very impressed with a material called Embrace Varnish, which comes from, again, pulp dent, because it has all the required minerals that we were looking for. It has sodium fluoride, it has calcium, and it has phosphate. Also, additionally, it has a component called xylitol. Now, xylitol, it gives a slight sweet taste to the agent. Although it is not a natural sweetener, it won't cause any harm to the teeth. In fact, it is very good, and it is very thin. It is transparent in color. Otherwise, varnishes, they give a very brownish or a greenish tinge to the teeth. So it is transparent in color. It gives a very lustrous look to the tooth. So it is also very easily dispensable. So it comes in these small packs, or it comes in a paste form, and it is provided with a small applicator tip as well. Now, Embrace Varnish, which is 5% sodium fluoride with calcium and phosphate, it is known to have inhibiting effect on the growth of cariogenic bacteria, and it promotes the conditions that favor remineralization. So basically, it is aiding the fluoride, calcium, and phosphate, our main minerals, to fight against the caries and also to give a healthy smile to the patient. Also, we need to understand that once the xylitol comes in contact with the saliva, it forms a protective fluoroapatite layer. And these ions react continuously in saliva with the fluoride ions to form this fluoroapatite on the teeth, which is a protective agent. So what we need to understand is once we apply the varnish on the teeth, we need to ask the patient to not eat or not have water or not brush their teeth for at least 3 to 4 hours. So there are newer agents which say, within half an hour patient can eat or drink or anything, but this particular brand, and which we need to understand that the fluoroapatite, it needs to be in contact with the tooth for about 3 to 4 hours. And after that, the patient can brush their teeth. Okay, so this is a case wherein, the same case where I had done whitening for the patient. She came, after the whitening, after a week or so, we saw that there is still some kind of demineralization on their teeth. So to add to the result of whitening, what we did is we applied the Embrace Varnish for this patient. The golden rule for applying the Embrace Varnish is that it should be applied in a very thin layer. So as against the bleaching agent, which is applied in a very thick layer, in the for the varnish, we need to apply in a very thin coat. So thin rinse in the Embrace Varnish. So here's a small video where you see how I have applied.
This is the Embrace Varnish. I'm going to first.
What we do is we just take the varnish gel behind and then tear it out.
And remove it here.
We dispense it on a dapping dish.
This is a single-use pack meant for
So the very important thing is it comes in single-use packs so that we don't waste the material. We know exactly the amount of material that
my varnish is ready.
Our varnish is ready. We will just want to lightly isolate the teeth with some
dry the teeth
cotton. So to wipe out the cotton, wipe up the teeth with the cotton. And then see how we apply. When we are applying it, it hardly takes 2 minutes, but see the amount of protection we are giving to our patient's teeth.
I'm going to apply a very thin coat.
The important is we need to apply a very thin coat on all the teeth and also on all the surfaces of the teeth. We want the fluoride varnish to come in contact with the saliva eventually. So we are not going to isolate it with rubber dam, with cotton rolls, no isolation required. We're just going to retract it and we're going to use it on each and every teeth. Okay. So this covers my third aspect of the webinar, which was using, empowering the tooth with some kind of fluoride. And my favorite is the fluoride varnish. Now we come to the next topic, which is using the bioactive restorative materials. So it's been so many years that we have all been using composites of various brands, composites of have containing a lot of important ingredients. But one thing that was missing in most of the composites is that the activity, which is called as bioactivity. So bioactivity is basically, it gives life to the material, it gives life to the tooth. The materials that we were using earlier of any brand, they were inert in nature. They had no interaction with the saliva. They had no interaction with the oral cavity, microflora, or with anything. So what we were doing is we were just doing some inert filling on the patient's teeth. So now this concept has become very, very important, and it's become very common. You will hear from many speakers talking about the bioactivity. So bioactivity for a material to be called bioactive, it should be the one which causes remineralization. It forms a hydroxyapatite layer, and it has some potential to regenerate the living tissue. Now, not all materials would have the property of regeneration, but the only criteria which is enough to cause a bioactive material, is that it should be able to form a hydroxyapatite layer, which is similar to what hydroxyapatite we have in our natural tooth. So the materials that I have used in patient's mouth is biodentine. Then off late, I've started using Activa Bioactive, which has this, which is a bioactive material, restorative material, which forms this kind of hydroxyapatite layer. And the material which I have used very commonly, and I am continuing to use very commonly in my practice, is my favorite, called as Activa Pronto. So the Activa Pronto, it is a material which can be used in class 1, class 2, class 3, class 4, class 5, class 6, all kind of cavities. Also, it is very good material to be used for geriatric patients, for the root caries, and also we can use it in pediatric patients. So basically, it has universal applications. It can be used in any and every case which comes to our clinic for a restoration. So what is so special about this Activa Pronto? It is the only composite that is mineral enriched, and it promotes biomineralization. So you remember the first slide where I told you what is important for the tooth: calcium, phosphate, and fluoride. So this restorative material contains all these three important ingredients: calcium, phosphate, and fluoride. Not only this, it induces the biomineralization, and it induces the apatite formation. And most important thing, it is hydrophilic in nature. So whenever we are doing composite, we are always scared of getting contaminated with some drop of blood, with some drop of saliva, and then it doesn't work and our composite debonds. So this is a material which is slightly hydrophilic in nature. It doesn't mean that you can do it without rubber dam. We can do it under proper isolation conditions. But if at all there is some gingival fluid or some little blood or little saliva, it won't affect the longevity of the restoration. Okay, so basically, as I told you, it releases calcium, fluoride, and phosphate, and it recharges the tooth. So not only once we restore the tooth with this Activa Pronto, the action is continuous. So it comes in contact with the saliva, and every few months it is staying in the patient's mouth, and constantly it is having some interaction with the saliva of the patient. So other materials, what used to happen is they were very inert in nature, and they had no interaction with the saliva. So we always see old composite margins have those black or secondary decay around their margins. So you would see that Activa Pronto, I'm yet to take a lot of follow-up photographs for the patient, but I'm sure that after a few years also, because few of the colleagues, they have been working with Activa Pronto since many years now, and they have shown the recall photographs wherein that black margin that doesn't come in, because this material has constant interaction with our saliva. Okay, so now regarding Activa Pronto, this is basically our material which is bioactive. We have the Bioactiva, not only the pulp dent company, we have different other companies like Septodont, which are coming out with biodentine. Even the material that we used as a base, Dical. Dical is also biomineralized. It can also be termed as a bioactive material because it regenerates. Like when we use it for the affected dentine, it regenerates the tooth. So the world is now moving towards bioactivity and towards biomineralization. So let us upgrade ourselves and not remain with our inert, dull-looking materials, and let us come to the life living, like it is called as a material which gives life to the tooth. So there are many cases which are there on the Facebook group of Activa Pronto, of Pulp Dent. So you are welcome to join those group, or you can ask me for many cases that I have done with this material. I can share the pre-op and the post-op cases and the entire notes that I have on this particular topic. Okay, now coming to the last part of our webinar, which is the Smile Rejuvenation by doing the Smile workout exercises. So basically, as we understood from the slide of the anatomy, we understood that, whatever muscles of the face, gravity is pulling down. And secondly, if they're not used to their full capacity, they tend to droop down, they tend to sag down. So what we need to understand is we need to lift them up. We need to make them firm. Now, there are invasive procedures like facial rejuvenation where people are putting Botox, they're putting dermal fillers, and they're doing the facelift or the smile lift procedure. But most of my patients are not looking for any kind of invasive procedures, as I told you, and they are looking for anything which is very natural, which is very non-invasive. So these are the pictures from the textbook called Fundamental of Aesthetics by Ruffinath. And actually the author has here mentioned, how we can do some retraining exercises for our face, and we can give better smile to our patients. So basically we need to train our patients to do these exercises, because people are now very conscious and they are doing a proper workout for their entire body. But the face area, it gets missed out. So here we see what the author recommends. So this is a very simple smile exercise wherein the patient is first closing the smile, like, just smiling without. What we need to understand is the corner of the mouth, these angles should go up for a natural smile. And if they're drooping down, that looks a old smile. So this patient has been just asked to repose for a little smile. Then the patient is asked to make the smile a little wider, but without showing the teeth. Then third step is patient is asked to make the smile even wider, but exposing some amount of the teeth. So each of this pose need to be kept for 10 seconds. So first 10 seconds, a gentle smile. After that, a little more smile, but without the teeth exposure. After that comes a little teeth exposure, but expanding the smile. Then comes expansion of the smile with more teeth exposure. And then comes a full-fledged smile. So you can see, like, how this muscles, the muscle of the corner of the mouth, the modulus that we studied, how it is getting activated and how we're achieving a natural smile lift over here. Then we have these slowly, so once we have done 10 seconds of each, 10, 10, 10, 10, 10, 50 seconds are done. Last is we need to come back to our original pose. Like how we do in yoga, we do the poses and then we come back to the natural pose. So from where we started, we need to come back to the same position. So after the patient has achieved the full smile, then ask the patient to reverse the smile. Like, coming back, less gentle smile and then gentle smile and coming back to the normal position. So this very simple thing, it appears like very, very common thing, but it is the thing which actually gives a lot of good smile to the patient. It actually extends the smile because with age, these muscles become very rigid and patients are not able to smile. Now, how in the exercises, we do some lifting to give strength to our muscles. So similarly, this author suggests weight lifting by finger pressure. So the same exercises, if we apply the finger pressure at the corner of the mouth, we can do these exercises again. So we apply some pressure. We start here in the reverse way. We first ask the patient to do complete smile, then little less smile, and then little less, and then gentle closed smile. And then this again stops with the reverse way. Gentle smile, little more smile, and then complete smile. These are the smile exercises with finger pressure. Okay, so this was about my small presentation. Okay, now I want this to be a more interactive one. So I'll just see if there are any questions in the chat box. Yeah, Dr. Shreya, you're right. I was talking about Dr. Rajiv Chidgupi sir only because he had told me to use the side surface of the scalar tip, and that has actually reduced the sensitivity in my patients. So this was about this thing, and if everyone is willing, we can do this exercise. So first is the smile exercise. What we are going to ask the patient, we're going to just ask the patient to give a gentle smile without the teeth exposure. Secondly, we are just going to ask them to smile little, then smile more, and even smile wider. Further, we are going to apply some pressure on the with the fingertips, and then we can reduce the smile. Okay. So this was about the exercises which are mentioned in the textbook. But besides that, there is a concept called face yoga, which is now in trend. There are authors like she's Mansi Gulati. She's the one who's written a bestseller book on face yoga therapy. Then there are many other foreign authors also who are recommending face yoga. So basically, just remember the concept that once our muscles of the face are exercised, they're going to give a very firm look. They're going to give a younger look. So how the exercise of the whole body helps a patient look younger, the exercise of the face is going to make them look younger. So why to spend money and why to ask them to spend money, or why to ask our patients to go for more invasive therapy rather when we have these kind of therapies available. So we can actually incorporate these things and make our patients smile better and rejuvenated and enlightening. Actually bright smiles which give very good look to our patients. So this is it. And lastly, I would also recommend laughter yoga. So laughter yoga by a very Indian doctor, Dr. Madan Kataria, is also very, very good therapy. So basically, there are in different parts of the world, there are these laughter clubs who ask people to smile, who laugh without any reason. But the effects of the laughter therapy on the body are marvelous. So if all of your videos were on, we could have done some laughter yoga also. Otherwise, I'm done for now. If anyone has any questions, please feel free to ask me. So my one last thing that I want to say is that just understand the concept, which materials, which minerals are required for the health of the teeth. Then you can go for any particular brand of your choice. So rather than using a particular brand, just look into the material. What are the ingredients of the material? Just understand what is the health, what will give health to the patient, what will make our patient's smile look healthier and beautiful. And accordingly, you can use those materials. Yeah, Aishwarya, you can take ahead now.
Thank you so much, ma'am, for a wonderful lecture and also giving us insights about the smiles and also for the laughter therapy. Thanks a lot. Every point was covered by you. So it was a very interactive session. So thank you so much, ma'am. If anyone has any question, please go ahead.
Also, I'm reading from the chat. Thank you so much for your compliments, Dr. Sanvi, Dr. Dwiti, Dr. Shreya, Dr. Vishaka. Thank you so much for joining in, and thank you so much for all your encouragement and appreciation. So, Aishwarya, do you want to share your products? I mean, your some slide you want to.
No, you covered it in your.
Yeah, right. Thank you, Dr. So, should we end the meeting or anything more to be done?
No, ma'am, we can end this.
Okay. Thank you so much. Thank you so much, everyone, for joining in. And we are now ending the meeting. Thank you. Bye, everyone. Have a nice day.
Thank you, everyone. Thank you, ma'am, for a wonderful lecture.
Most welcome. My pleasure.